As operators of senior housing and assisted living facilities, we know the problem facing our increasingly competitive industry, the trade-off of giving our residents the highest quality of life while controlling their costs and our own. Of course, you want to ensure your residents live as independently as possible for as long as possible, but in addition to affecting residents' physical and mental well-being, every decision we make has a financial cost, whether for our residents or for our business. Telehealth is an exception, a solution to this trade-off. Telehealth can provide your residents with 365 days a year of medical monitoring and intervention, maximizing their health and wellness. At the same time, offering your residents telehealth service gives your business a significant competitive differentiator that not only empowers your residents to participate in their own medical outcomes, but also sustains and grows your census, enabling you to control costs and even drive growth. Integrated telehealth has been widely used and studied in government and academic contexts, but partly due to prohibitive costs, telehealth hasn't been available to business owners like us until now. Through Connections 365, the first affordable and commercially available integrated telehealth solution built by an experienced team of leaders in long-term care, technology, and resident advocacy. Here's how it works. It all starts at a Connections 365 kiosk. In less than 90 days, your residents could be using one to monitor 5 key vital signs. Hold your personal key fob within 6 inches of the fob reader. Allow the kiosk to take your blood pressure. Press Continue. Allow the kiosk to take your weight. Press Continue. Allow the kiosk to take your pulse oximetry reading. Press Continue. Enter your glucose if you're diabetic. After reviewing your results, you may end the session if the results are normal. The kiosk then transmits results to a secure HIPAA-compliant database where they're assessed for any abnormalities using a patient-specific algorithm. Any abnormal vital signs are reported to a registered nurse and trained telehealth professional who can notify your facility and the patient's family, as well as initiate referrals to local medical services. The facility is also able to provide reports prior to the physician visits. And while securely logged in at the kiosk, a resident can also simply pick up the phone to instantly be connected with a registered nurse with access to their health information. By ensuring your residents receive early intervention to changes in your health, you can help them restore their independence, which helps you maintain and increase census by preventing unnecessary discharges and extending length of stay. But like everything in our business, it all starts with maximizing residents' health and independence, which is where Connections 365 has a proven track record of success. Numerous studies have shown that telehealth monitoring improves long-term health and wellness. In a long-term study by the U.S. Veterans Health Administration, seniors who received remote telehealth monitoring had 20% fewer hospitalizations and 25% fewer hospital bed days than seniors without telehealth monitoring. These results help explain why the VHA telehealth monitoring program enjoys 90% participation and 86% satisfaction, and why the VHA has increased its use of telehealth over 20-fold since 2003. And considering Connections 365 costs less than most monthly gym memberships, whether you offer it as a value-added or paid service, it pays for itself in more ways than one, because when your residents thrive, so does your business. When it comes to the financial health of your business, success is tied to 2 critical factors: overhead costs and census. With Connections 365 Telehealth, there is no need to increase staff to run the program, and there are no upfront equipment costs beyond a 1-day training and setup fee. And think about how much time and money you save by reducing disruptive drives to and from doctors' offices. When it comes to your census, revenues are directly tied to your ability to attract prospective residents and retain current ones. Connections 365 helps on both fronts. First, it serves as a significant competitive differentiator, appealing to both residents and their families, helping you drive new business. And secondly, because telehealth has a proven track record of reducing hospital admissions and sentinel events, Connections 365 helps you maintain your residents' independence, keep rooms occupied, grow your census, and drive revenue. Connections 365 can help your business achieve similar results by providing your residents with daily monitoring of 5 key vitals and proactive intervention to prevent sentinel events. And by helping your residents live longer, more independent lives, you also help your business by growing your census and differentiating you from the competition, ensuring the long-term health of both your residents and your business. To find out more about how Connections 365 can help your residents and your business, click here to get started.